Today, on the Men's Medical Moment, we're discussing the newly insidious Delta variant and why the COVID pandemic has been more deadly for men than women. We did everything the CDC told us to do. We wore masks. We socially distanced when we could. We sanitized our hands throughout the day in order to keep our families and the world safe. Despite this, many have died, and it is believed that many more will soon. As the COVID virus recently morphed into the latest variant strain known as Delta, the world prepares to mask up once more. Since the disease was discovered in December of 2019, men more than women have paid a heavy toll in the number of hospitalizations and deaths. To understand how we got here, you must first understand how viruses spread. Take the original COVID-19 virus, for example. The original strain emerged from Wuhan, China in December of 2019 and rapidly spread unabated throughout the globe and subsequently declared a pandemic in March of 2020 by the World Health Organization. Now, by that time, the virus had spread courtesy of people by planes, trains, and the traditional automobiles throughout the globe. The world community had not faced a threat so great since the original influenza virus over 100 years earlier. Most scientists in the field of infectious disease felt that the original virus spread long before December of 2019. But that is a case for another time. Now, in a rapid move to save lives in May of 2020, the Pfizer company became the first developer to seek a full U.S. patent for the approval of a coronavirus vaccine. In December of that same year, 2020, the United Kingdom became the first country in the world to approve this vaccine and begin rolling out an initial 800,000 doses at the start of that particular month. Now, but that would not make a dent in what we're going through right now. You see, but none of these actions had any bearing on what would ultimately emerge as the Delta variant. The Delta variant is our main concern right now. You see, most viruses go to metamorphosis in the competition of dominance for the same strain. Now, due to the ability to adapt, the virus can either become much stronger than its original self or much weaker, allowing vaccines and the body's natural immunity system to defeat it. In the case of COVID, we had the original outbreak, the Alpha strain, the Beta strain, then the Gamma strain, followed by the current Delta strain. If you haven't guessed by now, these strains are traditionally named by the scientists in the Greek vernacular to aid you with the understanding of the descendants of the original virus or disease. So, let's track the global process of these new strains and how they are coming to town in a town near you pretty soon. The initial virus rapidly morphed into the Alpha strain in the country of England, heavily in the month of September of last year. Now, this caused the Prime Minister to prepare his country for a second lockdown. If everybody was angry from the first, they pretty much didn't like the second. Before that, the Alpha strain was previously the dominant strain in the United States and has been reported in at least 173 countries, according to the World Health Organization. In South Africa, that original COVID virus morphed into the Beta strain in August of 2020. So it's the second strain of the same virus. Now, this particular one overwhelmed the country's ability to keep up with an already overburdened medical system and outdated system and treat patients who were rapidly dying from the virus. Now, remembering that in some cases, the variant of any virus is in its own makeup spreads more than the original virus. You're watching MNN, the Men's Channel. Now, in Brazil and Japan, for the most part, the COVID virus morphed into the Gamma strain. Now, this was first spotted in Amazon city of Manaus in December of 2020 and has contributed to a surge in cases that strained Brazil's health system and led to oxygen shortages, where they had to borrow oxygen from their neighbors and from the global community. Now, this brought us to where we are today with the Delta strain and the tragedy in the country of India. And you can't turn on a news channel without seeing how they have to deal with this strong disease. And in the land of Bharat Varsha, The COVID-19 virus morphed into one of the most contagious and already deadly forms of the virus, being the Delta variant. Now, the Delta variant severely overwhelmed the country's hospitals again and traditionally crematoriums, and has since been found in 104 countries. It is estimated to be a 55% more transmittable disease than the Alpha, and almost twice as infectious as the original strain that began spreading worldwide in early 2020. But make no mistake, although the Delta variant is more deadly than all of the others, it is like all the others and have been migrated from the original source throughout the globe. So it's not stuck to one country. So let me tell you what to look for if you believe you have the Delta variant. Here are some of the symptoms you may experience if you acquire this deadly strain. Now, you should look out for things like cold-like symptoms. Now, this includes headaches. You may have runny nose and a sore throat. This is slightly different than the COVID-19 symptoms of loss of smell, shortness of breath, fever, and persistent cough. Now, it's a direct difference between the two, but you might want to check with your hospital to make sure. So when scientists engineered the different versions of the vaccine to combat the original COVID virus, they knew that it may also be effective against a form of the strains that would ultimately offshoot from the original virus, which is where getting the vaccine comes in, why you need a vaccine. Now, globally, countries do this and acquire vaccines so they don't repeat the mistakes easily predicted by the influenza virus in the rearview mirror of 1918. Now, back then, the influenza epidemic that swept the world in 1918 killed an estimated 50 million people, or one-fifth of the world's population was attacked by this deadly virus. Now, although we live 100 years away from that original virus, we still get inoculated today. And pretty much just like COVID, most people may have to get a booster shot similar to the one we get to ward off the flu annually.
You're watching MNN, the Men's Channel.
But scientists are still trying to determine that. Now, the World Health Organization estimates that worldwide, annual influenza epidemic results in about 3 to 5 million cases of severe illness and about 250,000 to 500,000 deaths. Now, the U.S. Center for Disease Control and Prevention, or the CDC, estimates that flu-associated deaths in the U.S. range from about 3,000 to 49,000 annually between the years 1976 to 2006. The CDC notes that the often cited figure of 36,000 annual flu-related deaths was derived from years when the predominant virus subtype was H3N2, and that this tends to be more lethal than H1N1 virus. But the current statistics on acquiring COVID and dying from the COVID make the annual flu epidemic pale in comparison. As of today, over 188 million people have acquired some form of the COVID virus, and 4 million people have died from COVID in one strain or another. Now, that number, an addendum from the Center for Disease Control states that the novel coronavirus disease of 2019, or what we commonly know as COVID-19, is shining a spotlight on the neglect of men's health at the local, state, national, and global levels. You see, they've turned away over the last decade from men's issues to strictly women's issues. Now, according to the largest body of publicly available the segregated data from global government sources, although no apparent sex differences exist in the number of confirmed cases, more men than women have died of COVID-19 in 41 of 47 countries. And overall, COVID-19 cases the fatality ratio is approximately 2.4 times higher among men than among women. In the largest survey of 72,314 suspected or confirmed cases of COVID-19 in China, men made up a total of 63.8% of the cases, and women 36.2% of those same cases. Now, the case fatality ratio was higher among men, 2.8%, than among women, 1.7%. Another study from China of critically ill patients showed that men with comorbidities such as hypertension, cardiovascular disease, chronic kidney disease, and diabetes had the highest mortality, and U.S. data showed similar patterns. So, let us take the number of deaths by gender in the country of Germany So far, just the year 2021 for comparison.
Here you will find a complete graph chart of the actual number of persons who have died in the country of Germany for the short year 2021. And here you can see by these numbers that men between the ages of 20 and 80 years literally are dying at twice the rate as their female counterparts.
In a separate report on 3,200 COVID-19 related deaths from Italy showed higher death rates among men than women across all age groups, with men accounting for more than 70% of the deaths. A multinational health research database used by the Trinex X network showed that among 14,712 males and female patients with confirmed COVID-19, men were older, were more likely to be hospitalized, and had a higher prevalence of hypertension, diabetes, coronary heart disease, obstructive pulmonary disease, nicotine dependence, and heart failure. So those are contributing factors, but not all of the factors. Now, men also had higher all-cause mortality than women, 8.1% versus 4.6% in the United States. Now, as of June 2020, 57% of deaths caused by COVID-19 have been men. With the exception of Massachusetts, all states in the United States have reported higher mortality rates among men as opposed to women. But what accounts for the major differences between sexes beyond the health community turning a blind eye to men's health over the past generation? Let's find out. You see, for one, according to the CDC, men appear more likely than women to experience severe outcomes from COVID-19, regardless of whether the men have underlying health conditions, according to a new study, which is done in New York by researchers. Now, they tracked roughly 5,000 patients of both sexes who were diagnosed in early 2020, found that men were sicker when first diagnosed, and that they had a higher need for intensive care treatment and higher rates of death than women. That alone would have caused you to put more funds into looking at that one particular issue. Now, this was true even though the men on average were younger, less likely than women to have risk factors such as obesity, high blood pressure, that previously have been linked with poor COVID-19 outcomes and death. So even minus that, but there is a biological component that researchers have found that the genders' bodies respond to the onset of COVID. So both genders respond two different ways, one based on the XX chromosome and one based on the XY chromosome. So scientists who study the virus have determined that men and women differ in both innate and adaptive immune responses, perhaps related in part to the sex-specific inflammatory responses resulting from X chromosomal inheritance. Now, the chromosome X contains a high density of immune-related genes. Therefore, women generally mount stronger innate and adaptive immune responses than men. Now, this differential regulation of immune responses in men and women is contributed by sex chromosomes, genes, and sex hormones, including, but not limited to, estrogen, progesterone, androgens, sex-specific disease outcomes after viral infections, and are attributed to sex-dependent production of steroid hormones, different copy numbers of immune responses, X-linked genes, and the presence of disease susceptibility genes. Now, if you don't want to get a COVID shot, you can't really blame what happens around you in your home, in your community. For the Men's Channel, this is Charles Rivers. Stay safe and get the vaccine. Thank you.